Now, we already talked about the breech birth and what are some prerequisites for the delivery of the breech baby. Now, let's talk about the steps that should be followed in delivering a breech baby. So, in this, we will talk about the delivery of buttocks, legs, and lower body. And then we will talk about delivery of head and shoulders. And then what are the complications of breech delivery and some other fetal malpresentations besides the breech presentation. So, delivery of buttocks. Distend the perineum. So in this the perineum is distended with the buttocks. So and then lie in the anterior posterior diameter. So this is, if you see, this is the antero-posterior diameter, and it distend the perineum. Perineum is the area surrounding the anus and the vagina. So it, once the hips are comes and touches the floor of the pelvis, then there is distension of the perineal area, and at this point the lie of the baby is in the antero-posterior diameter. You can see in this is the antero-posterior diameter. Anus is over the fourchette and episiotomy can be cut. So episiotomy is the surgical cut given in the perineal area to avoid the injury or tear of the caused by the delivery of the baby. So this surgical cut is important because if the episiotomy is not performed, usually the delivery of the baby cause tear, and it can cause tear which is not the normal surgical tear. It can cause the irregular tear, and it's hard to heal later on, and even stitching and repair is hard if it's not, episiotomy is not performed. So one, that skin is distended, that is the point when the hips come and touch the pelvic floor, and episiotomy can be performed. So this point, episiotomy, which is the surgical cut, is given, which is later on sutured, and then some special precautions are taken after the delivery of the patient with episiotomy. Delivery of legs and lower body. If legs are flexed, they will deliver spontaneously. So if the legs are flexed, and we already saw the pictures of the breech presentation with legs flexed, that if they are flexed, then after the delivery of the buttocks, usually the legs come out spontaneously on its own, and if extended, then they may need to be delivered using Pinard's maneuver. If the legs are extended, usually the pressure is exerted into the popliteal space, and hand is put into the popliteal space, and the legs are brought down, and they are flexed down, and different to bring the legs down. So flexed, it can be delivered spontaneously. If extended, they have to be delivered using Pinard's maneuver. Delivery of the shoulders. In this, the transverse diameter of the pelvic mid-cavity is important for the delivery of the shoulder. Anterior shoulder rotates into antero-posterior diameter. So with the rotation of the baby in this, once the hips and the legs are delivered, the baby is held with the cloth holding the hip, and then the turning of the baby is performed, usually 90-degree and then 180 degrees, to deliver the arm one by one, first the right and then the left. So baby is turned, and then delivery of the one arm is done, and then it is rotated back and the left arm is delivered. This is the position maneuver that keeps the baby's head flexed. Wigan-Martin maneuver. One hand using the index and the middle finger is on the maxilla of the baby on both sides of the nostril. With the other hand, the head is flexed, and so the head hyperextension of the head is prevented. Posterior arm shoulder reaches the pelvic floor, and then it too will rotate anteriorly. So first anterior shoulder rotated into the antero-posterior diameter. Once it is delivered, then the posterior arm reaches the pelvic floor, and then it is delivered also. Now the head of the delivery of the head. Morrisseau-Smellie weight maneuver, in which the first downward and then upward movement is performed, and head is kept in the flexed position by using the two fingers, and then the head is held from one and keep the operator or the assistant in this stage kept pushing on the fundus and pushed the uterus downward and pushed the head downward to facilitate in the delivery of the head. So this is the picture of the maneuver in which the two fingers, index and middle fingers, are placed on both sides of the on the maxilla, on both sides of the nostrils, and then one hand is on top, and the operator or assistant is pushing the fundus down to facilitate the movement. If this maneuver proves difficult, forceps needs to be applied. At this stage, forceps can be applied that keeps the head in the flexed position, so head can be delivered properly. The complications of breech delivery is baby getting stuck. That can occur. The after-coming head is usually is stuck, and then it's very important that the well-being of the baby should be assessed, because sometimes if the delivery is not possible, the baby is pushed down back into the uterus, and then emergency C-sections are performed. So baby getting stuck. Interference in natural process. Risk of death or serious injury can also occur. So these are very, very serious complications of breech delivery. Other fetal malpresentation, some other breech, besides the breech presentation in which the patient is in the antero-posterior direction, but the instead of head, the hip, buttocks and the legs and the foot are coming first. The other presentations that can be present at term include the transverse lie. If you see, this is the transverse lie. Then we have the oblique lie. This is the normal longitudinal lie with head coming first. Then in the transverse lie and oblique lie. Transverse lie is fetal long axis lies perpendicular to maternal long axis. So maternal long axis and fetal long axis are perpendicular to each other. Then oblique lie long axis of the fetal body crosses the long axis of maternal body at an angle close to 45. So that's the oblique lie. So long axis crosses the long axis of maternal body at an angle of 45 degree. This is an angle of 45 degree. 90 is straight, anything in between is 45 degree. So you see, this is the 45-degree angle. So that was all about the different steps performed to deliver the breech delivery. Nowadays, with the C-sections are becoming so common that it's very rare now to deliver the breech baby normally vaginally, and usually it's preferred to perform the C-section. Elective C-sections can be performed to prevent any complications associated with breech delivery. Fetal outcome is not very successful with breech deliveries, and complications can occur. So to avoid all these complications, area where the facility of C-sections are available, usually the obstetrician's first choice is go for elective C-sections to deliver the baby with breech presentation. So that's conclude our lecture, breech presentations or malpresentations at term. Thank you for watching sqadia.com.